coming up?
We're going to talk about infectious diseases today. Okay, so let's get to the topic. Okay. What do you suppose this is right here? This faucet. Anybody? Paronychia pus. Okay.
Right.
Okay. What's the most common cause of paronychia?
Staph.
Staph.
Strep.
Strep. That's good. Staph, strep, candida, gram-negative anaerobes, aerobes. It's a mixture. It's a mixture of things. Okay. So, so you see something that's tender and it's pus. You have an opportunity right here to actually nick it with an 11 blade and drain it, get a culture, and start patients on treatment. Okay. What are the most common antibiotics you put someone on? Anybody, Wayne?
Catholics.
Catholics?
Cephalosporin,
Cephalosporin? Anybody else?
yeah. Oh, good.
How come nobody said?
Cipro?
Cipro?
What about Cipro?
How old's the patient?
Cipro takes care of staph and strep. Oh, I'm assuming the patients are over 18 and their growth plates are intact, you know? So Cipro, I prefer to start someone Cipro with over 18. If they're underneath 18, you've got the choice of what you want to use, okay? Now I'm going to write down something that I like to use on all paronychias. It's hard to get, so you're going to have to get it at a specialty pharmacy. And the one we use around here is in Cream Ridge called Bond's Pharmacy.
We wouldn't use it before.
4% thymol, it stinks, it smells, in chloroform. Now, the trick to this is the following. You got to tell the pharmacist to put it in a glass bottle. Okay? Because if he puts it in any other than a glass bottle, it's going to melt the bottle and this thing's going to leak out. Okay? Chloroform is, I don't know if it's a chloroform or thymol, but it's one of these ingredients melts the plastic away. So not only glass bottles, but it asks them to put an eye drop. So when you write it, write down 4% thiochloroform, please place in glass bottle with eyedropper, okay, and give them like 2 ounces. Write in the prescription, get Bond's Pharmacy's number. If you don't all have it, you can get it. It's in most offices.
They ship out, right?
They can ship out. They can ship out, or the patient can go pick it up. They could fax them, mail them, whatever. Get them the prescription. The pharmacy will fill the prescription, and etc. They'll make arrangements. We're very used to dealing with them. They're very good. Now, there are other pharmacies that might do this. And maybe your husband knows other in North. And if you find out that we could get a compounding pharmacy, then by all means let us know so we could use others. In case we have patients in North, Central, and South Jersey, it depends on where they need them. Okay?
There's one in Northfield also.
Yeah, there's one in Northfield. I just don't know the name. Okay, so put the patient on Cipro and tell them to use it twice a day. And the patient will say, how do you use it? Tell them to put a drop or two around the lateral or medial nail folds, okay, and then like around the nail, basically on the top. And one just like put a drop underneath it. Tell the patient, it doesn't smell good, but don't worry about it, okay? You want to get better? Yes. Keep the hand, the finger out of water, because water somehow just aggravates the condition. Most of the time you see these in patients that, for profession, are hairdressers, or florists. People who are really constantly in water tend to get that, yeah.
What does this stuff do? Primal?
It basically kills anything there, except the patient. you know?
Okay.
Bacteria, whatever, candida, it's a good agent, okay? You don't see these in books, but you can have it made and it works very nicely. Go ahead.
Someone has torn off their nail from trauma, from whatever. Can they use this just prophylactically?
No, there's no need to.
Okay.
This is really only use it for paranoias.
Okay.
So give a systemic antibiotic and one that, and this topical medication, okay? It's better than using a fungal lotion, an antifungal lotion, etc., etc. It's very worthwhile. If you can culture it. Otherwise, empirically start them on Cipro for over 18.
You apply that, what, once a day or twice?
Twice a day, is the idea, yeah. Now, I'm going to kind of look for some other pictures because I did not have time to organize. I was very busy yesterday in Westville. Okay. That's not what I got this. Let me just see something. I want to show you something interesting. Okay. Concentrate on these areas right here. See this area, right? This is called the proximal nail fold. And Laura, can you describe this for me? What are you looking at here? Just describe the whole picture and then hone in on these areas. I want you to talk dermatology now.
Erythematous area on the nail fold.
Which one nail fold is it? 3. This proximal, lateral, and medial nail fold. This is the proximal, this is the medial,
Right.
and that's the lateral nail fold.
So erythema on the proximal nail fold.
Okay, and
On the
what,
third finger.
well, besides everything, what do you kind of get?
Looks swollen.
Swollen, it's buggy, it's swollen, it's edematous, it's erythematous, okay? And kind of like, it's also a little bit of hyperpigmented. So it's like not pure bright erythema, it's kind of like a hyperpigmented type of erythema. So you kind of have a feel that this is not a process that's been around for a while, okay? I don't think that you're going to look at that as opposed to the other one and say that this is acute. This is either subacute or chronic, right? Okay. Obviously there's distortion in the nails here, which, what do you suppose that kind of tells you? I'm thinking about this
Oh, it's
picture.
some kind of fungus infection.
Good. So the nail's probably distorted by a fungus infection, okay? Now, we'll talk with nail diseases. I'll probably do a seminar for the entire provider group, for the 40 people that we have. And we're going to talk about nails some other time. But let's assume now this is onychomycosis, and this is a paronychia. Since there's no pus, and it's been present by history for a few months, we're not talking about acute paronychia. It's more of a chronic type of subacute paronychia. And it's good to describe that in your notes because anyone who reads your notes will kind of get a feel for the picture. If you say it's acute, they're going to think, oh, it's pussy, maybe there's pus coming out, etc. Okay? If you talk to them about subacute, they're going to feel that it's tender, so you're still going to have some tenderness. Okay? However, there's not going to be pus. There might be bugginess, but not pus. It's always a little swollen, but there's no pus coming out of it. Okay? All right, so, now, eventually, I don't know if this is a good picture because I haven't reviewed it. What happens after severe recurrent episodes of paronychia, you get like the distortions of the nail and the surrounding skin.
Wow.
And this is a slide that I just picked out of, I don't